His head is not here, but it's slightly tilted. I'd say 30 degrees, and then rotationally about 45 degrees. My wife thinks I don't have good spatial awareness. I think I have exceptional spatial awareness. You be the judge of that one. Someone can use a measurement tool for that. Hey everybody, this is Dr. Warren here with Mike. Mike's a chiropractic assistant here in our office. We are in Baltimore, Towson, Maryland. We're an integrated practice where we provide chiropractic, manual therapy, massage, primary care, functional medicine, personal training, just a kind of a confluence of different providers and people here, and it's an awesome team. And one thing that comes and sees us quite often is vertigo or dizziness. Now, you can have this come from quite a few different areas relative to what causes or establishes that baseline of vertigo. And so, you know, having a proper diagnosis and having a proper treatment plan for it is really important. But one thing we do know about vertigo, especially vertigo and the origin of benign positional vertigo from the inner ear, is proximal positional, so BPPV, where, you know, the thing that gives us awareness of space that is aggravated, it can be the eyes, it can be the inner ear, it can be joints, neck, etc. From a balance standpoint, is the Epley Maneuver is very effective for treating that. So the Epley Maneuver is amazing, and it's kind of the gold standard for treating vertigo for patients in general. But one thing it does cause quite often that can be a little bit uncomfortable is it can cause a little bit more of that dizziness in the moment or the periods after using it. And for people that you know, that are coming to see me and they're like, and I've got to get on a plane at 4 o'clock today, I'm like, all right, well, how do I find this balance with helping this person out? Or in the other case that came in, I need to get my hair cut at 2 o'clock, and I'm like, really? Okay. Like, how badly do you need that haircut? Anyways, and so with treating it is that's the Epley Maneuver. With understanding it is or diagnosing it, right, is using a good history, and there's some things that we need to rule out in some cases, but oftentimes the history, as well as using simple orthopedic maneuvers like the Dix-Hallpike maneuver, where basically I bring them back quickly and turn them to the symptomatic side, and I look for nystagmus or twitching in the eye, right, and then also there's symptoms to occur. So kind of coming full circle, like, what's this video about? You've tried the Epley Maneuver maybe, or you're just curious about vertigo because you probably might have those symptoms. And this is a maneuver that has been very helpful for us with some of the cases that the people overreact to with the Epley Maneuver or are not responding to. Okay, and by overreacting, it's like they're getting way too dizzy doing it. It's too much, right? Which can happen. So if this is something that that you're contemplating doing at home, be mindful, right? It can make you dizzy, so have somebody there at home and make sure that you're getting proper and good support in the process of doing it, right? Because not all dizziness vertigo is alike. So for Mike, we'll show them the Epley Maneuver. And have you gone through this with me before?
A few days ago, yes.
Awesome. So you know exactly what you're doing, right? Yeah, you remember everything perfectly? No, I'm just kidding. All right, so we'll get started. And let's just say Mike comes and sees me, and he's like, we're going through things. He's like, you know, and I've been having it more recently. Kind of comes and goes, but last week was just, I had a string of really bad days. And, you know, I notice it if I'm rolling on my side and I'm sleeping on my right side at night and I'm starting to get those sensations, or I turn my alarm clock off because I want to sleep in and be late for work, and I touch that, press that alarm, and I turn and the room spins. The room spins. I have a feeling of uneasiness, right? And so that's very commonly ways described. I'll always look at cervical spine. I'm a chiropractor. I look at the spine as for a lot of root causes of things in general, but I'll oftentimes find joint fixations in the upper cervical spine along the symptomatic side. Okay, but my job as a chiropractor is to, from a spine standpoint, when I'm doing manual therapy, is to motion palpate, find where there's joint restriction, where their function is impaired, right, from a movement standpoint, and treat accordingly. Okay. All right, you're like, get to the point, right? I know. I'm going to show you how to do the Epley Maneuver. So swing your legs up here for me. And so I've examined him from a neck standpoint. I've established that he gets vertigo with right-sided cervical rotation. I've gone through a history relative to any trauma, any history of eye or vision problems. We talk about migraines a lot with these cases too. Autoimmune is also a component that I want to kind of sink into. But all right, he's a classic presentation for a good candidate for Epley Maneuver. So scoot back about a foot this way. All right, he's got right-sided vertigo, so he's going to turn his head to the
right.
Oh, you guessed right. 50% chance you got it. All right, so you're going to turn to the right and go back, straight back. And then I'm going to take him to 30 degrees of extension off horizon or off the table, 45 degrees of rotation, and then scoot towards your feet a little bit. The best is to really hold the person there, and when I'm doing the manual therapy, but on the edge of the bed as I'm educating people on this, this is kind of a good angle, if you will. Carly, show me those skills. Get down there and show people that his head is not here, but it's slightly tilted. I'd say 30 degrees, and then rotationally about 45 degrees. My wife thinks I don't have good spatial awareness. I think I have exceptional spatial awareness. You be the judge of that one. Someone can use a measurement tool for that. And so we sit here for 45 seconds, a minute, wait for the dizziness to go. If I'm doing this on somebody, open your eyes for me. I look for any nystagmus. He doesn't have vertigo, so he's not going to have it. And not all cases that have it, that have a good response to Epley Maneuver, not all cases that we see will have that nystagmus occur in the eyes. All right. Good? Mm-hmm. All right. You tell us, you tell the people that are going through this at home, what do you do next?
Turn to the left side.
At what degree?
Turn to the same thing, 30 degrees. 30 degrees flexion and then 45 degrees lateral, right?
Close. 45 degrees of rotation off of midline to the left, 30 degrees of extension, and you got to get it wrong before you can get it right sometimes. Good job, way to try. All right, and then so relative to that, he sits here for a minute and for his symptoms to abate. And then the literature doesn't tell you to go through it twice. I always go through it 2 times through. I work the person's canals twice, especially if they're not severely symptomatic in the moment, right? Which oftentimes they drove here, they walked in through my door, they're not laying on the floor, right, with me. That can totally happen. Just happened yesterday to a patient of mine, at home, that is. Where she's like, yeah, last week it was like 2 days, like I had to take something to take the edge off of it, right, which can help. After a minute here, he's going to go on his side, he's going to be facing that way. It's going to be awkward because I have a curtain here, and I usually move that curtain, so I'll do that. Make sure there's not a patient behind there. I am good. Thank you, Nicole. And he's turning his head how far to the left?
This part I haven't seen.
What?
I haven't seen this part.
Oh, man, he's like, you didn't show me this.
Nope, not this.
All right, here and here, 45 degrees, hanging out. Okay. And so I might put a pillow underneath their head. I might just hold them in this position just to give them that stability. 1 minute here, okay? So he went on his back. He turned to the symptomatic side, 45 degrees rotation, 30 degrees of extension. Then he turned to the asymptomatic side where he's not feeling the nystagmus vertigo when he turns. And then he rolls to that asymptomatic side at 45 degrees of just straight rotation. There's no head tilting back in extension. There's no head coming down in flexion. He just stays right here, okay? And then after a minute here, or till his symptoms abide, I help him out. This is a great way to sit somebody up. Arms crisscross, grab your elbows. It's more for Mike than you at home. I'm gonna hold here, I'm here. Go ahead and swing your legs as I pick you up. Oh, me.
Oh, to you.
Yeah. Let's try that again. That was so awkward. Let's go one more time. So you're gonna swing your legs out to in front. Okay, 1, 2, 3. Boom, pop up. There we go. Good. Okay, it's smoother, I swear, most times than that. So we did the Epley Maneuver. Okay, Mike's like, that was brutal, or no effect at all. Okay. Another thing that I can do is called the Half Somersault. Okay. And so what we're gonna do, you're gonna do like me. Okay. So you're gonna come up onto the table like this, and your hands are gonna be here and here. Okay. And you're gonna go ahead and put your hips back just a little bit, and your head is gonna go into extension. Okay, you're going to start here. You're going to wait till the symptoms stop, right? And so no dizziness in this position. Wait till that happens. You have right rotational vertigo. So you're going to go here, head down, turn your head to your right at your elbow. Good. And put the crown of your head in more flexion. Good. So you're going to stay in that position, okay? You're going to wait till those symptoms abide. You're not having the vertigo anymore. From there, you're going to go to quadruped. You're going to come up. You're going to keep your head tilted to the right. Okay. You're going to wait till those symptoms go away as well. Okay. It might be 15 seconds. It might be 5. Once they are, you're going to extend your head up and to the right. This is a little easier, not so far to the right, right there, now look up. This is a little easier to manage for somebody that might have a hard time falling to their back and tilting their head or laying on their back and getting up quickly. So I like this because it's a little bit more of a grounded position for him, okay? All right, symptoms are gone, relax, sit back onto your hips, and then look up. You're gonna repeat the process, okay? So I'll go through it twice, all right? Half somersault. And there's videos from the MD that came up with this protocol for treating the inner ear for BPPV. Great technique, and we've had good results with it for the people that don't respond well to the Epley. So if you're one of those people as well, it's a very safe, effective thing, and it's like most of these maneuvers, it's very, in most cases that need it, it's very helpful. Okay, so we'll try this. It really kind of is a full circle approach on that condition. Like I said, you can set up. I'm a chiropractor. I closely examine the neck, and I'll do manual therapy adjustments and treatment to that area because that area is so closely correlated with balance, with issues of like when there's noxious stimulus in the upper cervical joints, it can cause some of that aggravation as well. So you can have cervicogenic vertigo as well relative to that area. Sometimes people have more complaints in that region when they have it. So they'll say they get like kind of burning pain here, tension headaches, pressure on the back of their head. They might not know what that's coming from, right? Like they don't, oh yeah, it's my occiput and my upper cervical joints, they're stiff. They just like, oh, it just feels like a lot of pressure back here, right? And you can examine that. And you can really easily examine that through motion of the cervical spine. So those people, well, I'll tell them, they'll be all right-sided in presentation, kicks it off, and then I'll have them tuck their chin. You can do it. Turn your head to your right in that position, okay, where I'll passively do it. And don't try to aim for your shoulder. Try to actually, here, I'll guide you. Bring your chin down. And so my hands will be here, and I'll just guide them. See how I'm kind of turning as opposed to going like that? So keeping your chin in flexion, and I'll rotate. Good, I'll feel through here to see how it's approximating and moving. And then I'll do the same thing. You got a little something right there that can use some TLC on. You're trying to lift too much in those military press positions overhead, man. You need to take it easy in that gym. Okay, so Mike's going to chiropractic school. I'm excited for him. He's one of the exercise specialists here, and he jumps over, and he's a good sport, and I appreciate it being in the video. I hope that it helps you if you haven't tried the Epley Maneuver for vertigo. It's such a good, safe, effective treatment for a lot of people. And at the end of the day, in most cases, if it doesn't work, it's just like a good neck stretch, right? And then the other position, the relative to the Hunter Half Somersault, is something we've used over the last couple years a little bit more. Highly effective for sure as well for that. I hope that helps you. I look forward to putting out more educational videos and content. And if